2. HIV/AIDS and education. Some basic concept about HIV/AIDS. Dear trainees, before going to seeing what HIV and AIDS, from your own previous knowledge try to answer the following activities, but first do individually and discuss in group. Dear trainee, do you think that there is difference between AIDS and HIV to you? Dear trainee, if you have attempted it thoroughly as a responsible person, you performs an important duty that are expected to be known by every individual. And you are able to sensitize pupils, teachers and the community around you and about the dangers of HIV infection and about the disease, AIDS, which develops after infection with HIV. Therefore you need to have a deeper knowledge about HIV/AIDS. 1. HIV and AIDS. AIDS is the acronym for the term acquired immunodeficiency syndrome. Immunodeficiency means that there is something wrong with the human immune system. Immunity is the capacity of the body to resist the invasion of bacteria, viruses, and other pathogenic microorganisms, prevents the body from falling ill every day and allows one to lead a healthy life. HIV destroys the immunity of the body. Patients suffering from AIDS become very vulnerable to microorganisms that are unlikely to affect normal people. Diseases which manifest only very mildly in people with normal immune ability become very severe and incurable in people with AIDS. HIV is the abbreviation of human immune deficiency virus. It is a type of virus causes AIDS. After invading the human body, HIV destroys the T lymphocytes in human body system so multiplied rapidly that it is very difficult to develop a vaccine to combat it. HIV directly invades the immune system of the human body, destroying the immune cells that resist infection with the result that the immune ability of the body is grossly compromised. However, the HIV virus is itself very vulnerable. Outside the lymphocyte, HIV dies rapidly in the outer environment. Commonly used disinfectants, such as 84 sterilizing fluid, bleaching powder and alcohol kill it. 2. AIDS patients versus people infected with HIV. Dear students, what is the difference between AIDS patients and HIV-positive people? Dear student, when people think of AIDS, they often confuse HIV-positive with AIDS patients and are unable to differentiate the difference between the two. So for many people these two basic concepts are confusing. Let them see separately. People infected with HIV, people with HIV, or who are HIV carriers, are those who are infected with HIV but have no symptoms. They can be characterized as someone with 2 eyes, 1 nose, and 1 mouth, that is to say that they have the same appearance as any other person. AIDS patients. For people infected with HIV, their resistance to diseases is severely destroyed by HIV, to the extent that their bodies fail to resist even mild disease and different manifestations of diseases appear. Such people are called AIDS patients. When a person infected with HIV becomes an AIDS patient, he/she may die within half a year to 2 years. Dear student, from the above explanation you can observe that at the point when HIV enters the human body, we call the person infected with HIV or HIV positive. As this stage people with HIV positive people has shown the following characteristics: the person do not fall ill beyond cure on the very day HIV invades their bodies because the virus needs some time to reproduce itself in the human body. The immunity of the person has not been severely compromised, so no remarkable symptoms are apparent. During the 2nd to 4th week after HIV has entered their bodies, These people may have certain clinical manifestations, similar to flu-like symptoms such as a fever, muscular pain or a rash. They often look healthy and live and work just like those who are not infected. When the immunity of a person infected with HIV becomes severely compromised, to the extent that the body fails to resist the attack of HIV, other pathogens exploit this weakness. Pathogens invade and cause different diseases, such diarrhea, pneumonia, some carcinomas and even dementia. At this stage, people infected with HIV are considered AIDS patients. The clinical manifestations of AIDS are many and varied. AIDS patients may die of exhaustion caused by severe diarrhea, pneumonia and cancer. Based on the statistics from around the world, there is often a period between infection of HIV and the onset of AIDS. Such a period can last from several years to 10 years or more. It is called the incubation period. However, the length of the incubation period varies greatly. Some people with HIV fall 1 to 2 years after the diagnosis. There are a lot of factors that influence the speed of onset. Seeking medical guidance, effective preventive measures, good nutrition, and healthcare are factors that play an important role in postponing the onset of AIDS. Different periods of AIDS. Based on the statistics from around the world, there is often a period between infection of HIV and the onset of AIDS. Such a period of length can vary and last from several years to 10 years or more. Some people with HIV fall 1 to 2 years after the diagnosis. There are a lot of factors that influence the speed of onset. Seeking medical guidance, effective preventive measures, good nutrition, and healthcare are factors that play an important role in postponing the onset of AIDS. Therefore, medical experts identify 3 periods of AIDS. A window period. It is impossible to diagnose HIV infection immediately after the virus enters the body. Generally, the HIV antibody can be tested 2 to 3 months after infection. The period between the infection of HIV and the successful detection of HIV antibodies is called the window period. Only when HIV antibodies are detected can one's HIV status be determined. Although the HIV antibody cannot be detected during the window period, a vast amount of the virus already exists in the body fluid, especially blood, sperm and vaginal secretion. People in the window period are highly infective. If a person is tested shortly after a particularly risky activity and receives a negative result, he/she must be tested again 3 months later. It is only then that the antibodies will be detected if the person is infected. The incubation period, the time between being infected with HIV and the clinical manifestation of AIDS, is referred to as the incubation period. The length of the incubation period is generally 5 to 7 years, the shortest being 6 to 12 months and the longest being more than 10 years. The average length of this period is 8 to 10 years. During the long incubation period, an HIV-infected person shows no symptoms. They look and feel healthy and may not even know their own HIV status unless HIV antibodies are detected in their blood. However, HIV-infected persons during the incubation period are highly infective. They can transmit HIV to other people through sexual intercourse and through their blood. Therefore, any person who might be infected with HIV should seek HIV/AIDS counseling and/or HIV testing. See infective period. The so-called infective period is the period when the HIV-infected person or AIDS patient is able to transmit the virus to others. With regards to AIDS, the entire period between being infected with HIV and the death of the patient is considered the infective period. Generally speaking, the HIV-infected person is the most infective during the window period and at the very onset of AIDS, and less so during the incubation period. However, since the incubation period tends to last for a rather long time, average of 8 to 10 years, this plays a major role in the transmission of HIV. Main clinical manifestation of AIDS: when the immune system of an HIV-infected person is severely destroyed and fails to resist the attack of opportunistic diseases, this person eventually becomes an AIDS patient. The advanced stage of the disease is reached once the HIV-infected person fails to prevent the onset of AIDS. There is no escape from death. AIDS has no specific clinical manifestation. Its symptoms and signs are varied and complicated. The following are some clinically common symptoms: protracted low fever, weight loss by 10% or over during a short time, pathologic leanness, fatigue and night sweat, chronic diarrhea, chronic cough, headache, dementia and inactive response. Infection, nodes and tumors in the skins. So far, medicines for AIDS have no long-lasting effect. AIDS is still an incurable disease. The course that AIDS will take depends on the constitution of the patient, his/her living conditions and the level of medical treatment. In the end, AIDS patients die of prostration caused by infection and cancer. How to determine if a person is infected with HIV? Activities. Dear student, please imagine what an AIDS patient could look like and then ask yourself the following questions: are they male or female? Are they young or old? Are they fat or thin? Are they poor or rich? What do they do for a living? What does their skin look like? Then compare your responses with your classmate, for example student sitting next to you. It is impossible to determine if a person is infected with HIV or not through one's appearance, since the virus can be hidden in the body for a long time without manifesting any signs or symptoms. To determine if a person is HIV infected, generally a blood test has to be done to see if there are HIV antibodies in his/her blood. Antibodies are a substance in the blood used to resist the invasion of bacteria and viruses. Antibody is produced by the immune system. The presence of the HIV antibody in the blood shows that the person is HIV infected. The absence of the HIV antibody in the blood, that is, negative test result, shows that the tested person is not infected. Or is infected but is within the window period, since the production of antibodies needs 3 months, and a further test should be suggested. The different modes of transmission of HIV/AIDS. A. Modes of HIV transmission. Dear student, can you mention some of the mode of transmissions of HIV? Since HIV mainly exists in blood, semen, vaginal secretion and breast milk of people who are infected, any behavior that causes such body fluids to enter another person's body may cause HIV infection. Under normal conditions, skin and mucous membrane are natural barriers against infection. However, those barriers may be damaged by cuts, abrasions, sores, or ulcers, all of which are capable of infection. There are 3 modes of HIV transmission. 1. Through sexual intercourse. Sex is a major mode of transmission of HIV infection. Like other sexually transmitted diseases, such as gonorrhea, syphilis, genital herpes etc., it can also be transmitted through unsafe sex between sex partners. The HIV in the semen, vaginal secretion, or menstrual blood of an infected person may enter the body of another person through the membrane of genitals. Homosexual and bisexual behaviors are also high-risk activities exposing the participants to HIV/AIDS infection. What is unsafe sex? Unsafe sex means sexual behavior that causes the entrance of blood, semen, or vaginal secretion into the bodies of one or both sex partners. Unsafe sex may result not only infection by HIV that endangers one's life, but also it resulted in unwanted pregnancy that may result in artificial abortion, influencing mental and physical health, school performance, and one's career, infection by STDs resulting in infertility, etc. 2. Through contaminated HIV blood or objects. These may include transfer of blood products that contaminated with HIV, transplant of an organ of an infected person, syringes or needles used have not been sterilized or adequately sterilized, the principle of one syringe per person fails to be observed. Other medical instruments that pierce the skin, such as those used in dentistry, obstetrics, gynecology, surgery and acupuncture that have not been sterilized or adequately sterilized before reuse. Instruments used in barber shops, beauty parlors, tattooing, pedicure and ear piercing are not sterilized before reuse. Personal items such as razors, electric razors or toothbrushes are shared. Bleeding and physical contact occurs during sports. The damaged skin of a person providing first aid comes into contact with the infected blood from the wounded. 3. Mother-to-infant transmission. Transmission of HIV from an infected woman to her fetus or infant may occur before, during or after birth and during breastfeeding. The conditions under which HIV can't be transmitted. It is as important to know under what conditions HIV cannot be transmitted as opposed to conditions where HIV can be transmitted, so as to avoid unnecessary fear of AIDS. HIV can't be transmitted by the following routes: food, drinking water and air, casual person-to-person contact in public places, for example, in classroom, cinema, market, and swimming pool, or contact with seats, handrails, notes, coins, and bills, things for office use, transportation, or in workshops, etc. Courtesy kissing, courtesy hug and handshaking, sharing of toilet and bathtub, or insects bite. The major impacts of AIDS on personal and societal life. In the previous topic you have seen that the way that AIDS transmits, and in the following section you will deal with the effect that spread of AIDS have on human. Dear trainee, in general AIDS has significant effect on the following social segments. The effects of AIDS on society. It is hoped that you had listed a lot and debated on it. Today the issues of AIDS become a social issue. This is because each member in society may become a direct or indirect victim of the prevalence of AIDS. As a result, it is currently causing major damage to our society. For instance, from your nearest town you realize that many children have lost their parents through AIDS and are become now orphaned. When this happens, the children are left without anyone to feed and clothe them and pay their school fees. For some children, this may mean dropping out of school. Those who remain in school may be laughed at by other pupils. Such children cannot learn well. Some may run away from school and live in the streets. Parents who are infected may be continuously ill. They lose money in their efforts to get treatment. Eventually, they may be unable to look after their children or pay fees for them. Many ill parents lose their jobs in despair. Their families suffer when they are unable to work and bring home money. Teachers may also be infected with HIV and may die of AIDS. During their illness, their pupils suffer. Their families, friends and relatives will be concerned. Eventually, the very sick leave their jobs or die. The government uses scarce financial resources to pay them while they are ill. From these you can see that HIV/AIDS do not only affect those people infected with HIV but also the entire society, and hence everybody needs to fight against it. Effect of AIDS on individuals. HIV-infected persons are often discriminated by society. Concern and care are seldom given by relatives and friends. In addition, finding out about their HIV status can cause great stress and can feel like being given a death sentence. Once the HIV infection develops into AIDS, the health of the patient deteriorates rapidly, resulting in even greater psychological stress and terrible physical pain. Effect of AIDS on the family. The discrimination against HIV-infected persons by society brings disaster to their families. As with the infected person, family members have to bear a heavy emotional burden, which can lead to conflict and even disintegration. As a result, HIV-infected persons tend to become alienated and homeless. They are shifted into different parts of society, causing other social problems. Some HIV-infected persons are the main source of income of their families. When they are no longer able to work, they instead have to pay heavy expenses for their treatment, thus the financial situation of their families will worsen rapidly. Families with AIDS patients may have to give up their children or their elderly members to be cared for by others. Effect of AIDS on national economy of the country. AIDS mainly attacks young adults 20 to 45 years of age, who are in the prime of life, the producers of society, breadwinners of their families, and the defenders of their countries. Loss of this adult population is irreparable to families and to the society. The elite of society are not immune from AIDS. The experience in Europe, America, and Africa shows that the HIV infection rate among those who are well educated, or with a high level of scientific and technological knowledge, is the same as those among other populations. This is also another important segment of society that would be of a great loss to a nation. The existing medical technology fails to cure AIDS. Upon reaching the point of the onset of AIDS, the patient will die in just a few short years or even months. Thus, AIDS is a threat to the health of human beings, increasing human mortality and shortening life expectancy. The incubation period between the infection of HIV and the onset of AIDS is much longer than in other infectious diseases, which makes it a rather deadly disease for several reasons. HIV-infected persons do not have any symptoms and can unintentionally infect other people. People who come into contact with an HIV-infected person, who may not know anything about his/her HIV status until much later, do not adopt any protective measures. The fact that there is such a long incubation period until the symptoms manifest, 10 years or more, will have a profound influence on society. AIDS mainly attacks young adults 20 to 45 years of age, who are in the prime of life, the producers of society, breadwinners of their families, and the defenders of their countries. Loss of this adult population is irreparable to families and to the society. The elite of society are not immune from AIDS. The experience in Europe, America, and Africa shows that the HIV infection rate among those who are well educated, or with a high level of scientific and technological knowledge, is the same as those among other populations. This is also another important segment of society that would be of a great loss to a nation. Strategies to prevent AIDS. Dear student, in this section, you will look at what you can do in fighting and presentation of this catastrophic disease. Dear, would you identify some of your role that as a teacher you should play in HIV/AIDS education programs? You may be aware that many people do not accept change easily. Often there is resistance. Resistance may come from your head teacher, other teachers, pupils and their parents. Some influential people such as business people, local councillors and politicians may also resist change for various reasons. Educational change may be driven by society or it may be initiated by the education system. In the case of HIV/AIDS, the pressure has come from the whole society and education has responded by revising its curriculum. The topic has been introduced officially into the curriculum of Ethiopian education. Norton, 1975, stresses the importance of society's impact on education and thereby explains why significant happenings in society, such as the occurrence of HIV/AIDS, led to changes to the school curriculum. The school curriculum in the widest sense is essentially a selection from the culture of a society. Certain aspects of our life, certain kinds of knowledge, certain attitudes and values are regarded as so important that their transmission to the next generation is not left to chance in our society but is entrusted to specially trained professionals, teachers, in elaborate and expensive institutions, schools. Realizing this fact, the Ethiopian education policy in the document of ESDP, 4 strategy is designed to creating an HIV/AIDS-free environment in the education sector in Ethiopia. Its objectives are to prevent the spread of HIV, in collaboration with Ministry of Health and other ministries, in the public, private and formal and informal education sectors by targeting learners, trainees, teachers, facilitators, families and other education sector staff. Its major components aimed at mitigating the pandemic are: 1. Mainstreaming HIV and AIDS interventions into the education sector's structures and processes. 2. Integrating HIV and AIDS issues as pertinent research topics of the tertiary level institutions and 3. Promoting HIV/AIDS awareness through extracurricular means such as anti-HIV/AIDS clubs at schools. Teachers can use 3 change strategies in fighting HIV/AIDS and actualize the country's education policy strategies to fight AIDS. These are: the rational empirical strategy, which requires you to convince your community that HIV/AIDS should be taught; the power coercive strategy, which means that you can use your authority as a teacher to teach HIV/AIDS, and the normative re-education strategy, which emphasizes mutual cooperation and collaboration between you and your pupils and the community. The above methods have advantages and disadvantages. However, it is up to you to choose the most appropriate according to your situation. As a classroom teacher, the following are some of the things you can do. Integrate HIV/AIDS topics into all the subjects you teach. Provide guidance and counseling to your pupils or ensure that the school provides this service. Work closely with health authorities on HIV/AIDS prevention measures. Promote health education and responsible behavior among other teachers and pupils. In addition to this, programs should include education and counseling of adolescents in the areas of gender relations and equality, violence against adolescents, responsible sexual behavior, responsible family planning practice, family life, reproductive health, sexually transmitted diseases, HIV infection and AIDS prevention, and the prevention of sexual abuse. Moreover, initiatives must safeguard the rights of adolescents to privacy, confidentiality, respect and informed consent, respecting cultural values and religious beliefs. Therefore it is important to teach or make aware youths and adolescents about sexuality and sexual education, so that teachers become equipped about the knowledge and skills of understanding about sexuality and sexual education in their effort to address the problem. With this sentiment, let us see about sexuality and sexual education as one mechanism of preventing HIV/AIDS. Sex and sexuality. Dear learners, recently sexuality and sexual education has gained more attention worldwide with a view of preventing HIV/AIDS and other STDs through educating the young so that they develop appropriate modes of conduct in their sexual behavior. The reason for such educational intervention is that since the major mode of transmission of HIV/AIDS was through unsafe sex, sex-related education is believed to be more effective in mitigating problems associated with sexual behavior rather than keeping especially the young in a shroud of secrecy and superstition. Dear trainee, would you explain what sex is in your own words and how the society you come from is open in awakening the young about sexual issues? The word sex is used in various ways and its usage changes from reference to the sex cells to sexual behavior. Most literatures define sex as one's biological characteristics, anatomical, breasts, vagina, penis etc., that define one as a male or female. Sex is also a synonym for sexual intercourse, which includes penile vaginal sex or oral sex. Sexuality is an expression of who we are as human beings. Sexuality includes all the feelings, thoughts, and behaviors of being male or female, being attractive, and being loved, as well as being in relationships that include intimacy and physical activity. On the other hand, sexuality is a key part of being human and affects people throughout their lives, from birth to death. It is about our bodies, feelings and behavior as males and females. It includes issues related to gender, sex, sexual orientation, pleasure, relationships and reproduction. We can express our sexuality through our thoughts, beliefs, desires, fantasies, attitudes, values, behaviors, roles and relationships. We express it in the way we walk, talk, dress, dance, sing and enjoy being with people of the same and opposite sex. It includes all the ways that we enjoy expressing ourselves as sexual beings. Our sexuality is influenced by a wide range of factors: social, political, biological, psychological, cultural, economics, religious, legal and historical. What do you understand from the above explanations of sex and sexuality? Sex education and its importance. What is sexual education to you? Why it is important to teach about sexuality in schools. Sex and sexual education is an educational experience aimed at developing capacity of adolescents to understand their sexuality in the context of biological, psychological, socio-cultural and reproductive dimensions and to acquire skills in making responsible decisions and actions with regard to sexual and reproductive health behavior. Therefore, the main task of sex education should be to provide fundamental knowledge of the physiological, psychological, moral, cultural and social aspects of sexuality so that the learner is able to act and feel responsible by mastering one's own feelings and impulses. Although sex is a universal and fundamental human attribute being more common in traditional society, people rarely talk about sex openly. Effective sexuality education is a vital part of HIV prevention. While it is not realistic to expect that an education program alone can eliminate the risk of HIV and other STIs, unintended pregnancy, coercive or abusive sexual activity and exploitation, properly designed and implemented programs can reduce some of these risks and underlying vulnerabilities. Moreover, effective sexuality education is important because of the impact of cultural values and religious beliefs on all individuals, and especially on young people, in their understanding of this issue and in managing relationships with their parents, teachers, other adults and their communities. Studies show that effective sexual education programs can reduce misinformation, increase correct knowledge, clarify and strengthen positive values and attitudes, increase skills to make informed decisions and act upon them, improve perceptions about peer groups and social norms, and increase communication with parents or other trusted adults. Summary: in this unit, you have been given basic information about HIV/AIDS and sexual education. We hope that you have got more information from the unit. However, you are recommended to dig from different other materials or health authority. The implications of HIV/AIDS were also outlined in particular relation with education in this unit, as well as strategies that you can use to overcome this epidemic have been indicated to address it. As one major strategy to mitigate the spread of the diseases, we tried to discuss about sex, sexuality and its importance.